Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Let me introduce myself. My name is Nabilah Azizah Gunawan, NPM H1A021027. I'm a medical student of Bengkulu University 2021. Today, in this video, I would like to present an article about normal bone anatomy and physiology. First, introduction. This information lays the groundwork for understanding the utility and clinical applications of islet crest bone biopsy. And then next, the aim. This review describes normal bone anatomy and physiology as an introduction to the subsequent articles in this section that discuss clinical application of islet crest bone biopsy. Next, method. The normal anatomy and function of the skeleton are reviewed first, and then followed by a general description of the process of bone modeling and remodeling. The bone remodeling process regulates the gain and loss of bone mineral density in the adult skeleton and directly influences bone strength. Thorough understanding of the bone remodeling process is critical to appreciation of the value of and the interpretation of the result of islet crest bone histomorphometry. Osteoclast recruitment, activation, and bone resorption is discussed in some detail, and then followed by a review of osteoblast recruitment and the process of new bone formation. Next, the collagenous and non-collagenous protein components and function of bone extracellular matrix and summarized, followed by a description of the process of mineralization of newly formed bone matrix. The action of biomechanical force on bone are sensed by the osteocyte syncytium within bone via the canalicular network and intercellular gap junction. And the result, concept regarding bone remodeling, osteoclast and osteoblast function, extracellular matrix, matrix mineralization, and osteocyte function are synthesized in a summary of the currently understood functional determinants of bone strength. Okay, the discussion. First, the skeleton. The adult human skeleton has a total of 213 bones excluding the semosid bones. The appendicular skeleton has 126 bones, axial skeleton 74 bones, and auditory ossicle 6 bones. Each bone constantly undergoes modeling during life to help it adapt to changing biomechanical force, as well as remodeling to remove old, micro-damaged bone and replace it with new. Mechanically stronger bone to help preserve bone strength. The four general categories of bone are long bones, short bones, flat bones, and irregular bones. Long bones include the clavicles, humeri, brady, ulnae, metacarpals, femurs, tibiae, fibulae, metatarsals, and phalange. The short bones include the carpal, tarsal bones, patellae, and sesamoid bones. And flat bones include the skull, mandibles, scapulae, sternum, and ribs. Irregular bones include the vertebrae, sacrum, coccyx, and hip bone. Flat bones formed by membranous bone formation, whereas long bones are formed by combination of endochondral and membranous bone formation. The skeleton serve a variety of functions. The bones of the skeleton provide structural support for the rest of the body, permit movement and locomotion by providing levers for the muscles, protect vital internal organs and structures, provide maintenance of mineral homeostasis and acid-base balance, serve as a reservoir of growth factors and cytokinesis, and provide the environment for hematophysis within the marrow spaces. The human skeleton is composed of 80% cortical bone and 20% trabecular bone overall. And then next is bone growth modeling and remodeling. Bone undergoes longitudinal and radial growth, modeling, and remodeling during life. Longitudinal and radial growth during growth and development occurs during childhood and adolescence. Modeling is the process by which bones change their overall shape in response to physiologic influences or mechanical force, leading to gradual adjustment of the skeleton to the force that is encountered. Bones may widen or change axis by removal or addition of bone to the appropriate surface by independent action of osteoblasts and osteoclasts in response to biomechanical force. Bones normally widen with aging in response to periosteal apposition of new bone and endosteal resorption of old bones. Bone remodeling is the process by which bone is renewed to maintain bone strength and mineral homeostasis. Remodeling involves continuous removal of discrete packets of old bone, replacement of this packet with newly synthesized proteinaceous matrix, and subsequent mineralization of the matrix to form new bone. The remodeling process resolves the old bone and forms new bone to prevent accumulation of bone microdamage. Remodeling begins before birth and continues until death. Next, osteoclasts. Osteoclasts are the only cells that are known to be capable of resorbing bone. Activate multinucleated osteoclasts are derived from mononuclear precursor cell of the monocyte macrophage lineage. Mononuclear monocyte macrophage precursor cells have been identified in various tissues, but bone marrow monocyte macrophage precursor cells are thought to give rise to most osteoclasts. Next, osteoblasts. Osteoprogenitor cells give rise to and maintain the osteoblasts that synthesize new bone matrix on bone-forming surface. The osteocyte within the bone matrix that support bone structure and the protective lining cells that cover the surface of quiescent bone. Within the osteoblast lineage, subpopulations of cells respond differently to various hormonal, mechanical, or cytokine signals. Osteoblasts from axial and appendicular bone have been shown to respond differently to these signals. Self-renewing, pluripotent stem cells give rise to osteoprogenitor cells in various tissues under the right environmental conditions. Bone marrow contains a small population of mesenchymal stem cells that are capable of giving rise to bone, cartilage, fat, or fibrous connective tissue, distinct from the hematopoietic stem cell population that give rise to blood cell lineage. Next, bone extracellular matrix. Bone protein is composed of 85 to 90% collagenous proteins. Bone matrix is mostly composed of type 1 collagen with trace amounts type 3 and 5 and FACIT collagens at certain stage of bone formation that may help determine collagen fibril diameter. Osteoblasts synthesize and secrete as much non-collagenous protein as collagen on a molar basis. The non-collagenous proteins are divided broadly into several categories, including proteoglycans, glycosylated proteins with potential cell attachment activities, and carboxylated proteins. The roles of each of the bone proteins are not well defined at present, and many seem to serve multiple functions, including regulation of bone mineral deposition and turnover and regulation of bone cell activity. Next, bone matrix mineralization. Bone is composed of 50 to 70% mineral, 20 to 40% organic matrix, 5 to 10% water, and less than 3% lipids. The mineral content of bone is mostly hydroxylated with small amounts of carbonate, magnesium, and acid phosphate, with missing hydroxyl groups that are normally present. Matrix maturation is associated with expression of alkaline phosphate and several non-collagenous proteins, including osteoclastin, osteopontin, and bone sialoprotein. It is thought that these calcium and phosphate binding proteins help regulate and ordered deposition of mineral by regulating the amount and size of hydroxylated crystals form. Bone mineral provide mechanical rigidity and load-bearing strength to bone, whereas the organic matrix provides elasticity and flexibility. Bone mineral is initially deposited in whole zone between the ends of collagen fibrils. This process may be facilitated by extracellular matrix vesicles in bone, as it is in calcifying cartilage and mineralizing turkey tendon. Next, osteocytes. Osteocytes represent terminally differentiated osteoblasts and function within C-shell networks to support bone structure and metabolism. Osteocytes lie within lignin within mineralized bone and have extensive filipodial process that lie within the canaliculi in mineralized bone. Osteocytes are active during osteolysis and may function as phagocytic cells because they contain lysosomes. Osteocytes maintain connection with each other and bone surface via their multiple filipodial cellular process. Connexins are integral cellular proteins that maintain gap junction between cells to allow direct communication through intercellular channels. Next, determinants of bone strength. Bone mass account for 50 to 70% of bone strength. Bone geometry and composition are important, however, because larger bones are stronger than smaller bones, even with equivalent bone mineral density. As bone diameter expands radially, the strength of bone increases by radius of the involved bone raised to the fourth power. The amount and proportion of trabecular and cortical bone at given skeletal site affect bone strength independently. Bone material properties are important to bone strength. Some patients with osteoporosis have abnormal bone matrix. Mutation in certain proteins may cause bone weakness. Bone strength can be affected by osteomalacia, fluoride therapy, or hypermineralization states. Bone microstructure affect bone strength also. Low bone turnover leads to accumulation of microfractures. High bone turnover with bone resorption rather than bone formation is the main cause of microarchitectural deterioration. And then the last one is the conclusion. The skeleton serves multiple functions. Bone modeling and remodeling preserve skeletal function throughout life. The bone remodeling unit normally couples bone resorption and formation. Bone matrix regulates bone mineralization. Bone strength depends on bone mass. geometry and composition, material properties, and microstructure. Okay, I think that's all from me. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.